Our motto at Plymouth State is that I may serve, right? Like that is a foundational value at our university. And to have an EMR that's giving us metrics showing data on how we're serving our community, I think is a really beautiful thing. My name is Stephanie Sprout. I'm a doctor of physical therapy, and I am an associate clinical professor at Plymouth State University in Plymouth, New Hampshire. My primary responsibilities in this role are running our integrated clinical program on campus, which is a course that students take every semester that they're not out on their clinical rotation, and that manifests as an on-campus pro bono physical therapy clinic. And that is how I got connected with Prompt, because we have been using their EMR for the last 2 years in our clinic. When I have other faculty members that are reviewing notes, they can hop in, they can leave notes for the students in the team comments section. So they're not needing access to my online platform through our Canvas. It's really a challenge to get other instructors added into those at the university level. But now all I have to do is create that person in Prompt, give them access, and they can jump in, they can review everything, they can do grading, they can give notes to the students that they're supervising, and we don't have to go through that extra multiple rounds of me emailing it to you. It's taken a lot off my plate from incorporating other clinicians into our clinic for supervision hours as well. That bridge of classroom and didactic knowledge into clinic is one of the biggest challenges that we've heard from our clinical instructors across the board. And on the flip side, one of the biggest pieces of feedback that our director of clinical education continues to get from our clinical partners is that our students are better prepared than the majority of their peers when they enter their first clinical rotation, because they've had 3 semesters on campus treating patients in our pro bono clinic doing documentation. Everybody would moan when they got assigned to the scheduling team. When it was their semester to be in charge of scheduling, that was everyone's least favorite piece of it. And that has really shifted with the transition to Prompt. I don't hear nearly as much complaining, which is nice. But one of the goals for the clinic is to really prepare students for whatever setting and whatever role they're going to transition into. And for them to walk into their first job interview and say, I have managerial experience in a clinic. Let me tell you what I've done. And to be able to talk intelligently about scheduling, about clinic management, patient profiles, patient experience from an EMR standpoint, I think it's making our students more marketable. Prompt has really impacted our strategic goals in the clinic to be able to present, this is the number, this is how many people we've served. Being able to have such meaningful data at my fingertips has allowed me to grow our program a little bit, to talk about it really thoughtfully. This is an invaluable service. Our cancellation rate is significantly lower than averages for the PT clinics in the area. We've had over 6,000 visits in our clinic just since we started using Prompt. And to just have those sheer numbers to present and to the students, this is the impact we're having.